Good morning, good afternoon. Today, welcome to the historic signing of a Memorandum of Understanding between the World Health Organization and the International Olympic Committee. I'd like to hand over to Dr. Tedros, the Director General of the World Health Organization, for opening remarks.
Oh, sorry. Thank you, Paul. And thank you, President Thomas Bach, Dr. Richard Budget, and your colleagues at the IOC for your work in fostering this collaboration. Thank you also for your support of the COVID-19 response, Mr. President, in particular for joining WHO in promoting the Healthy at Home and Be Active campaigns. Today's Memorandum of Understanding builds on the long-standing relationship between the World Health Organization and the International Olympic Committee, and it builds on our partnership with other sporting organizations, including FIFA. Sport is a natural partner for WHO. By its very nature, sport is about participation, bringing individuals, communities, and countries together, and bridging cultural, ethnic, and national divides. We know that sport has an important role in achieving the health targets of the 2030 Sustainable Development Goals. The goal of increasing physical activity by 15% over the next decade. Sport also contributes to health and education, promotes tolerance and respect, and empowers women and young people. This new Memorandum of Understanding enables us to work together across 5 key areas: advocacy for physical activity, preventing NCDs and promoting healthier lifestyles, strengthening the health legacy of such as Olympic and Paralympic Games, promoting grassroots and community sports programs to reach and encourage participation by more girls, older people, and people living with disability, and in strengthening collaboration between ministries of sport and ministries of health. Finally, today's event also serves as the launch pad for the WHO Walk the Talk, Health for All Challenge, which is taking place today. The talk, this is our 3rd year, but the first virtual one. I'm grateful for the IOC's support for its global virtual event, which is running on our social media channels today and tomorrow, to provide a healthy and positive start to the World Health Assembly on Monday. So once again, thank you, President Bach and Dr. Budget, for your support and commitment. This MOU is just a piece of paper, but together we can make it a reality that touches the lives of millions of people and helps to create a healthier, safer, fairer world for everyone, everywhere, and look forward to working with you more closely than ever before to serve the people we serve together. I thank you.
Thank you, Dr. Tedros. It's my pleasure to hand over to Mr. Bach, President of the IOC.
Thank you very much, and thank you, Mr. Director General, Dr. Tedros, for your very warm welcome and for having this opportunity to sign this agreement today between the World Health Organization and the International Olympic Committee. It gives us the opportunity, as you were mentioning, Mr. Director General, to even our collaboration, which is going on already since 36 years, because we are sharing the same goals in the World Health Organization and the IOC It is to promote physical activity for better health. And in this respect, we are fully aligned with the United Nations Sustainable Development Goals in many ways. So this signature shows once more that we are walking the talk, as your action is called, even if I'm told that after the signature we will not walk the talk, we will write the talk, so maybe even more dynamic. With this MOU, we can also address challenges and opportunities we saw from the ongoing COVID-19 crisis, because it has become how important sport is for general health, and how general health is important to combat the virus and to overcome the virus. There we can see that people with a healthy and active lifestyle have much better chances to combat the virus. And therefore, we are ready to continue to make our contribution to fighting this COVID-19 crisis with our contribution through sport and the call for a more active society. Because sport is extremely low cost, but as we can see once more, highly effective tool for health, not only with regard to the non-communicable diseases, but also with regard to other diseases like the virus. This is why we are calling on the governments of the world to appreciate, to honor this important role of sport and physical activity for health, and to include sport and physical activity and then also into their support programs, which they have been approving right now across the globe, because sport is not only a very important economic factor in this world, offering millions of jobs, it is even more an extremely important social factor and health factor. And there, if the crisis has told us something, is how important health is, and health the basis for everything we do in society. So I'm really calling on the governments of the world to honor this role and to make sport an important part of their support programs. I would also like to thank you, Mr. Director General, and all your team around here for the most valuable advice we are receiving from your organization for many years, but in particular since February this year, with regard to the Olympic Games Tokyo 2020. Your team has helped us tremendously to take the right decisions at the right time, which then were also appreciated by the world community, not only in sport, but also by the political leadership. And we are very happy and very proud that we can count on this advice also when it comes now to make the historic effort to organize for the first time in Olympic history postponed Olympic Games in an environment which is safe for all the participants of these Olympic Games going to take place now next year from 23rd of July on, means in 1 month, in one year and 2 months from now. So we are really counting on you and your team, and we are looking forward to this effort to make these Olympic Games then the light at the end of this dark tunnel humanity is in, and there to celebrate together in solidarity and unity then humanity all together across the globe. Thank you very much, Dr. Tedros and all your team. And now, as we say in the IOC these days, here we go. This signature is just the start for action. Thank you.
Thank you, Mr. Bach. Thank you, Dr. Tedros. Now, we'd like to proceed to the MOU signing section of the event. So, if you could.
It says in the paper that this cannot be considered to be an international agreement, but the formalities are obviously nevertheless very, very strict. You really make me working here hard, Dr. Tedros. Maurizio is even checking on me whether I do it diligently enough.
Thank you very much. Now, I would like to proceed to the official photo ceremony shot and a presentation of gifts before commencing the mini press conference. And we have a presentation of gifts to make now between Dr. Tedros and Mr. Bach.
The title of this piece of art is "The Sky is the Limit." And I think we are sharing this ambition in the World Health Organization and the IOC that just the sky is the limit. So thank you very much for your cooperation. And I hope this is correct if I put it there.
Thank you. And this is for you and IOC. This is the Health for All medal from the World Health Organization. So we're very proud to partner. And as you rightly said, you know, this OU is, here we go. And we will continue to preparing the plan of action and then move into action quickly. So thank you so much again.
Thank you. I will put it next to my Olympic gold medal.
Exactly. Thank you. Thank you so much. Thank you.
Good morning. Now we will move to a session of question and answers from our friends, the journalists all around the world. I will just remind the journalists that we have with us Dr. Tedros, Director General of WHO, and President Thomas Bach, President of the International Olympic Committee. So we will start by giving the floor to journalists just to remind you that if you want to ask a question, just click raise a hand. That this will enter you into a queue for a question. You will find this icon under participants. Thank you. So we have now first journalist, Rachel. Can you hear us? Rachel, can you hear us? Can you please unmute yourself? No. Sorry, Rachel, we cannot hear you. We will maybe move to another journalist, hoping to be able to talk to Rachel later on. Ajit, we have another journalist. Can you please ask your question?
Yeah, thank you.
Yeah.
Am I audible to you?
Yeah, you are.
Yeah. My question is to Dr. Bach. Sir, even if after 1 year, in July 2021, next Olympic Games are organized, do you think that it will be as grand as it was supposed to be, or it has been for past few editions? Because WHO says that even if a vaccine is developed, the virus will be far from over. It will still be there, and infection chances will be there, will remain there. So do you think it will be as grand as it used to be? Thank you.
Thank you very much for your question, which is indeed a very valid one. We have established there in the IOC one principle, and that is that the games must be organized in a safe environment for everybody. This is why we have started there with a joint task force, including the World Health Organization, already in February this year. And we could take there the very valuable advice of the World Health Organization into account already for our postponement decision. We are counting on the WHO's support and advice there also for the time to come. So that in the end we can ensure this safe environment for the Games. I think now 1 year and 2 months away from these Games, it's too early to start speculation on different scenarios and what it may need at the time to guarantee this safe environment for all participants of the Games. This is why we are working here together and addressing this issue day by day, and will adapt then to the safety needs, whatever they will be at the time of the Games.
Thank you, President Bach. We will move now to... Can you hear me? Avijit, you have the floor.
Yeah, this is Avijit Nandi Mazumdar from ANM News India. My question again to Dr. Bach is that, Mr. Thomas Bach, is that now that 1.5 years left, 23rd July is the next Olympic meeting. Now, how in such a circumstances without a vaccine and with a lot of body contact games, you have a lot of body contact games there in the Olympic. So how do you propose to manage those body contact games in the Olympics?
Oh, thank you again. You know, we are 1 year and 2 months away from these games, and then we will take all the necessary decisions at the right time, relying on the advice of the World Health Organization, discussing it in our joint task force. But I think nobody can, at this moment in time, really give you a reliable answer on how the world will look like in July 2021. So we have to be vigilant, and we have to be patient at the same time to take the right measures to ensure the safe participation of everybody in the Games.
Thank you, President Bach. We have another journalist from Japan. Can you hear us? Yuki, can you hear us?
How about this? Can you hear me?
Yes.
Good. Thank you so much. Wakako Yuki from the Yomiuri Shimbun. One question each to both gentlemen. Dr. Tedros, the WHO in the past had said that exercise is a vital part to counter non-communicative diseases. Would you say there was scientific evidence that those active lifestyle and exercise by the people would be able to counter communicative diseases, especially COVID-19? one question to Dr. Bach, President Bach. Those exercise activity is its key part, very important, and sport should have one of the value recognized in this area much more, in my opinion. But of course, these activities would be by grassroots. It's generally by a general public, and you have to give them enlightening, give them incentive to instigate their change of their behavior. What can Olympic movement and perhaps top athletes could do in this regard? Thank you.
Yeah, maybe we can ask our technical officer to take this question. We have with us Dr. Maurizio Barbecci. Go ahead.
Thank you for the question, and is a subject which is under constant review from the scientific community over years and years and years. What we learn in this COVID experience, that every day, every week, because of the collective efforts, we know more. And the more we know, the more we connect several parts of our clinical and social understanding of this disease. As the Director General and the colleagues always says, it's not the single measure, it's not the single masking, it's all of the components of the public health response and the individual response that matters. So social and physical activities, thinking of ourselves better, looking and trying to convey a positive message is always at the pillar of any individual, family, societal events. So all of those collective science and knowledge is reinforcing at every day and every more. And together we are getting this knowledge and sharing as much as possible.
Thank you, Maurizio. We have no more questions for now. So,
can I answer the question I got?
Yes, please. Yeah, please.
Thank you, Yuki. I was already missing your voice on our press conference 2 days ago, so good to hear you. Good to hear you here. In fact, we are undertaking many efforts to encourage people to be active on the grassroots level. One of this is why we are here today, to be more active with the World Health Organization and to support the walk, the talk action. But we are doing much more together with our national Olympic committees and the national federations, the clubs, the many volunteers being active in sport. But for these grassroots efforts, all these volunteers and the civil sports movement needs the support of the governments and of the public health authorities. This is why we are calling on the governments to recognize this important contribution of sport to public health and to promote it and to support it with all the programs they have made available right now. On the level of the Olympic Games, we are also trying to give examples there for sports activity and for physical activity. We have started there with the Olympic Games 2016 by having the first initiation programs, sport initiation programs, which were open to the public and were a great success. There are similar efforts underway for the Olympic Games Tokyo, and We are working very closely, in particular with Paris 2024, where there is a number of mass events being planned on the occasion of the Games, but maybe even more important, a big number of mass sports events in the lead-up to the Games, where all the French people and all their guests are invited to take part in sport and in this way to take part in the Olympic Games. And finally, with this crisis, we have started an initiative with many athletes around the world taking part. It's an action called Stay Strong, Stay Active, Stay Healthy, where these athletes on the Olympic Channel and other social media platforms are encouraging people to be active, to take care of their physical health, but also very important in these times of corona crisis to take care of their mental health by being active. They are giving lessons, they are showing examples, they are motivating all the people around the globe to do sport and to live a healthy life, even in these very difficult conditions. And we are very happy that in the meantime, close to 200 million people across the globe have been following this action, and we hope many more will do and will indeed stay strong, stay active, and stay healthy.
I think Mr. President encouraged me to maybe add something to what he said. In WHO, especially the last 2-3 years, we have been involved in a very serious transformation. And we have identified 3 major pillars. And the organization, or WHO, is now organized around 3 pillars. And the first pillar of the 3 pillars is about healthy populations, keeping people healthy, keeping people outside hospitals, actually. And this can happen by, as you said, when people are active, when they do physical exercise. But not only that, as Mauricio was saying, it's the environment we live in, it's the food we eat, it's the other things that could be the root cause of ill health. If we can address those issues, we can stay healthy. It means keeping people away from hospitals. Then the second pillar is universal health coverage. Whatever we do, the people will of course be sick. We can only minimize it. And then we need to have access to health services. The second pillar is universal health coverage, or what we call health for all. And then the third pillar is emergency preparedness and response. Even after identifying cases, treating them or tackling, some of the illnesses like what we see now, COVID, could evolve into outbreaks, epidemics, or pandemics. And that third pillar takes care of the emergency preparedness and response. But to prepare or to prevent emergencies or outbreaks, or to prepare, it starts actually from pillar 1, keeping people healthy. 1, it will keep them away from disease. But second, since they're physically fit, when they get sick, they could tolerate the illness even better. So pillar number 1 is the most important. And in our new WHO, the investment will be in promoting health. And that's what we have actually started implementing few months ago before COVID started, and reorienting the organization toward this healthy, investing in promoting health, and then the other 2 pillars. So our partnership with you is central because the partnership between International Olympic Committee and WHO focuses on the first pillar, which helps people to stay healthy. And Olympics or athletics or football is not just for the athletes only. It has to be for everybody. Everybody should stay active. It has to be, you know, a culture for everybody, and it has to be everybody's responsibility, each and every individual, to stay active, meaning stay healthy. And from this memorandum of understanding, as we have agreed with you, Mr. President, we will move into preparing our action plan, and one of which we will include will be of course, the Tokyo Olympic. And the world, if it fights with unity and global solidarity, I think we can make a difference before the next Olympic. And we hope Tokyo will be a place where humanity will gather with triumph against COVID. If we do our best, especially with national unity and global solidarity, I think it's possible. It's in our hands, but it's not easy. That's why all of us as humanity should really fight in unison to defeat COVID and leave it behind us. So thank you so much, Mr. President, and your colleagues for today's event. This MOU is very important and historic. We're signing it in the middle of a serious pandemic, and I hope this will be one of the additions that will prepare the world for the next pandemic and keep away from such kind of keep away the world from such kind of pandemic. So thank you. Vielen Dank.
Thank you very much, Mr. Director General, for all your support, your kind words, and you can count on the IOC. We are really not only joining hands, we are joining forces there, and will come to action right after this signature. And if I'm well informed, the two of us will come into action even right now. Exactly. So thank you to you and all your team again for your great support. Thank you.
I would like also to thank journalists online and tell them that we will send them the audio file of this press conference, the introduction remark by both the speakers, and the press release. Thank you and have a nice weekend.